Welcome, everyone. Thank you for joining us today. I'm Sara Payne, Vice President of Inprela, a healthcare communications firm. Today, I have the pleasure of sitting down with Jodi Hubler, President of Bind. During this time of health crisis and time of such uncertainty, I wanted to get Jodi's perspective on how the health insurance industry is responding to the pandemic and get her take on what lies ahead. Hello, Jodi. So grateful to have this time with you.
Hi, Sara. Thank you. Thank you for having me.
Jodi, there are a lot of questions and anxiety around there today on a number of different topics related to the COVID-19 pandemic. Let's address some of the questions that might be on the minds of benefits managers, HR leaders, as they're thinking about meeting their employees' health needs. First off, as a health insurance plan, how has Bind adapted in light of COVID-19 to meet your plan sponsors and member needs?
Yeah, I think one of the areas that we have adapted to most is by really leaning into Bind's core. And by that, I mean, we established the company really focused on individuals inside of that group risk pool. So the ability to go back to our core roots of our product design really help our plan sponsors make sense and navigate of the recent coverage changes, of which we were already in alignment. That ability to really retrench to our core and lead out of a position of a foundation was really helpful in giving those plan sponsors some sure foundation on which they could make then individual decisions for themselves in the context of that. A great example being when the CARES Act came out regarding vaccinations, when the FFCRA came out and had changes around $0 copays. The Bind plan already had that in place. That afforded us an opportunity to really give a sense of stability for those benefit managers that are dealing with a myriad of issues facing them related to COVID.
Yeah, that's interesting. We've seen, I think, a lot of health plans, putting out press releases, et cetera, on different modifications that they've made to coverage. And interesting, really, that Bind, given your plan design, has not had to make as many changes.
No, we haven't.
So what's your perspective, Jodi, on the impact that COVID-19 is having on employers?
I think it's far-reaching. Sara, uniquely that I spent a good chunk of my career in the first half of my career as an HR leader, as a CPO, a head of human capital for a variety of sizes of businesses, multi-billion-dollar publicly held companies. I had the honor and privilege of leading in 9/11, also leading through the internet bust, through elements of the Great Recession as an investor. One of the unique aspects about COVID is it's far-reaching and the unknown unknowns about this. We're not dealing with regional impacts in hurricane season or the sense of instability and the sense of far-reaching impacts, not only in health, but then to rates of unemployment, to the ability to really serve and meet their employees at all needs. So I think one of the aspects that's going to be far-reaching for these benefit managers is really leading not only from kind of their sense of policy and from kind of the implementations of good programs, but it's also coming alongside them in heart. And that's one of the things that I think is going to be a unique challenge in that we're responding to unprecedented times for these folks to have to really come alongside their employee base in ways that are just completely and utterly brand new, but leading into a sense of stability as well.
Yeah, I mean, you talked about that, both that financial strain and really the need to support the health of their employees right now. It sounds like, to an extent, what you're saying is the risk of maintaining the status quo is going to be so much greater now, and that really our eyes are more wide open to that than ever before.
Yeah, I think absolutely. One of the pieces that we're walking alongside our plan sponsors is, those who have already implemented moving to the copay, the removal of the deductible, having been able to give that cost clarity and coverage clarity inside of a buying plan. They're now seeking to expand that kind of certainty in other areas of benefit coverage, in other areas of employee programs, in a way that can give that sense of, again, the already mentioned, that sure foundation for their employees in such an uncertain time. Being able to have something that is that foundational element, particularly at that intersection of healthcare in such a time as this, is really critical.
Yeah, absolutely. What have you learned, Jodi, about leading during this time of change? You're both head of a health plan and an employer. What insights can you share with other leaders in terms of what you've learned?
Well, one of the pieces I think that we've talked most about is that in times of crisis, character is exposed before it's developed. And one of the pieces that is a real blessing inside of Bind is that we are so fundamentally design-led with such an intention and purpose that you come back to that. And so one of the pieces is, I think, multi-pronged, but I'm gonna play at some of those main culture and value components, right? So at some level, you are empathetically normalizing to what you know. You're leaning into your communication plans in a way that is intending to not overly lead and not overly lag your employee base, but to come alongside them. In absence of information, people make stuff up. Very rarely do they make up things that are positive. And so one of the roles is to crystal clear communication, really leading in at a level of empathy. One of the unique pieces about COVID that really fits with Bind culturally and Bind as a product offering in insurance is that every individual is impacted by this. This isn't, this is level setting across the whole. So the ability to be able to craft that message to the 200 binders, to our members, and to our plan sponsors, the communication component, the empathy, the clarity, and the ability to lead both with that sense of our hearts as well as with our actions has been significantly important for our level of communication during this time.
I really love that. Thank you for sharing that perspective. Let's turn back to health insurance again. And can you comment on, does the pandemic create a stronger sense of urgency for new insurance design?
Oh, absolutely. It is. It has exposed some of the fundamental and caused challenges to the fundamental tenets of health insurance. And it has exposed how far afield we have come in the insurance design. It's one of the pieces that we spend a significant amount of time in our prospects and a significant amount of time with many of who I would consider still to be colleagues in benefits. When you have a $4,000, $5,000, even $6,000 deductible, and you have monthly premiums for a family that can range, let's just say on average, between $350 to $500. That's an $11,000, let's roughly call it, load on that employee. The ability to really have a government-sponsored support that's saying, well, let's give $1,000, let's give $1,500. In one fell swoop of a plan design, the ability to eliminate that financial burden of such a high deductible and such a premium load in such a time as this, it absolutely has exposed where we are on insurance levels, where we have just fundamentally kind of lost sight of the definition of insurance, lost sight of the definition of what we want health benefits to be and what their intended use was. And we've over-indexed into that financial engineering that has at some level lost that sense of heart. And COVID has clearly exposed, clearly brought out elements of just the bad plan design, the bad financial math, the bad financial model. That is, it's no longer okay It's no longer okay that we allow for that kind of burden to be used, and the pandemic is clearly exposing that.
Yeah, I love this idea. I love what you said, the idea of bringing heart back into insurance design, because certainly surprise medical bills are the last thing that someone with COVID-like symptoms or a COVID diagnosis needs right now.
Sorry, Sarah. One of the things that I think that will challenge to that conscience is that hopefully this pandemic will have marked all of us with the challenge why, what have we learned from this that allows us to then look at the way we treat non-pandemic like conditions, and why can't it be different? And I think we will have a collective cause that will come out of that saying it's not okay that I am an individual inside of this group risk. Allow me to have the opportunity to really tailor and design those benefits to my unique needs at the same time of really taking advantage of that financial pooling that we all can benefit from.
Yeah, I love this reflection on, what should we keep and what should we leave behind? And, I'm hearing you say it's time. We need to leave behind that deductible. And it's time moving forward that we bring forward more cost clarity, more transparency. Anything else in terms of this, what we should keep and what we should leave behind?
Yeah, I think there's some elements of that we really need to also start to flip. And it's one of the core tenets inside of our design. When you build the way work should be done into a consumer's path, into a member's path, you start to see a different level of behavior change. So rather than having an array of tools, an array of touch points, I think at one point in time, our assessment is that any given member, any different employee might have as many as 40 different touch points competing for their ear, for their eyes to pay attention. When you integrate that into a mobile platform, when you integrate it into a way that arrays choices, that allows them to understand their for coverage choices, you start to see different behavior. And it just is integrated into a level of simplicity that allows for a different experience. In addition to that, one of the pieces that COVID has clearly brought about is the implication of condition, right? We don't have people currently arraying themselves from a hospital choice. We're leading first and foremost with the condition, with COVID as an area that people are paying most attention to. I think there's a unique opportunity now to take advantage of Vine's model where we have condition-based benefit design, where you have an opportunity to really array to the unique needs of that member. And we're seeing that. We're seeing the system come alongside COVID as a condition. And how can we come alongside somebody that is concerned about exposure to COVID, somebody that's tested positive for COVID? Well, again, it's not okay that we don't do the same thing for the rest of our patient populations in a condition-based benefit design. What if we allowed for that same focus on diabetics, same focus on hypertension, same focused on pregnancy, same focused on depression? What if we, and through Bind, we afford that opportunity to flip it and start to look at condition as the focal point and driver from that on, then if said condition, what are my options? And if I know my options, how can I start to make choices that are right for me as an individual and interact within my health plan in a completely different way? And I think I hope for that coming out of this was such a focus on a condition-based benefit design through COVID that we might be able to see that have a changing impact and legacy against insurance design as a whole.
Yeah, I hope so too. You spoke a little bit there, Jodi, about differences in behavior that Bind begins to see from some of the members. Have you noticed any differences in Bind's plans as a result of COVID-19? Are you seeing any changes in the data you're looking at in terms of utilization or performance or behaviors? I know we're still very early on in all of this. Just curious if we're seeing anything that goes back to this behavior change component.
Yeah, I think one of the pieces that we've noticed, and I'll come back to that, is that in this time of crisis, you lean back to leverage what's your core. And because Bind had so inherently arrayed the options, members have that ability to know that if I'm no longer going to have the opportunity to go to the ED, or if I'm no longer going to have the opportunity to go to a particular site of service, what are my other options? And that clarity of arraying them can give that member a sense of comfort, a sense of sure foundation on which to say, wonderful, my telehealth option is available. My ability to call a help desk, my ability to interact on a mobile platform, my ability to understand that some of my other choices are available to me. I know what my pharmacy options are. I know how to go ahead and get a script when I might have my site of service from pharmacy shut down and only be available through the drive-through. What if I only want to go through telehealth? What if I only want to go through a call center? So being able to have arrayed those variety of choices, not such that the member has to know where to go, but it's actually driven in the way that they do work. We're seeing increase in telehealth. We're seeing increase in being able to come in and have conversations in ways that really align that member and give them, again, that confidence and that sure foundation that they don't have to be worried about whether or not they're going to be able to be seen in this time where there's such volatility in state by state, site by site, and what's taking place.
Do you anticipate, Jodi, that some of these changes in terms of how people are seeking care, remote services, telehealth services being one example, will be a sustaining change, in this post-pandemic era?
Absolutely. I mean, speaking from an investor perspective as well, the telehealth marketplace has been one that is, 10 years in meeting its market opportunity. I think there are elements of as I said earlier, in times of crisis, our character is exposed, and that ability to be able to see the options arrayed in ways that intuitively make all the sense in the world. I think we will have such a response on efficiency, such a response on consumer expectation, that it will be near impossible to pull that back. I think we are also starting to see a response from our plan sponsors that will also make what might have been some resistance now also start to see and lean into those opportunities in ways that they may have never thought possible, but now clearly have been made just an absolute given in this environment. They won't be able to go back off of that once exposed.
Yeah, I mean, there's a new cultural awakening, I think, both on the employer side and the member side, that's going to make a lot of these changes, hopefully for the better, long lasting, as we move forward here. What do you think all of this is going to mean in terms of employer budgets moving into 2021? Obviously, there's a long road ahead, right? And we don't know exactly how this is all going to shake out. But do you anticipate that employer-sponsored plan budgets are going to, go way up for 2021? And I'm not specifically referring to Bind plan sponsors. I'm referring to just in general, sort of the reality for employer sponsored health plans and what we carry forward here.
Yeah, I think at some level, health economists, others are weighing in on the impact. But, Sarah, I can tell you, I've had a couple of different calls with plan sponsors connected into our network. I think it's going to be total budgeting, right? I think there are a lot of people who are looking at it and saying, we've got the tale of two ends. We've got our health benefit side where utilization is going down, elective procedures are going down, utilization as a whole is being shunted. We're driving a significant amount of care to telehealth, and we're seeing a lot that are diverting. Yet at the same time, there's not a person who isn't worried in the benefit community and in the employer community about the consequence of furloughing employees, the consequence of social isolation. When you talk about social determinants of health, and we have people who are now isolated, we've got people who are also having to, lean into these unknowns, the mental health toll, the physical toll, the chronic condition exasperation is one that I know every plan sponsor and every health benefits leader I've talked to is concerned. So on the one hand, there is an economic view where costs are going to, at a level, go down because of our elective procedures and others. There is a bolus of activity that is not yet known, that is fraught with concern of how long this lasts and what we come out the other side knowing. And then it's a level setting of total budget. So we know already that benefits are disproportionately weighted. Benefits at healthcare and insurance disproportionately weighted. Yet we're also having to give significant time and attention to layoff, furloughs, and a number of other short-term disability, long-term disability, family medical leave, the expansion of family medical leave, short-term loans against 401ks. The entire benefit community is looking at this not as a single point solution about insurance. It's an algebra equation. It is a leveling across the whole, and they are having to make some very interesting choices around how they come alongside their employees at all sorts of different continuums. That might be a single individual, socially isolated. That might be a pre-retirement individual who now has financial worries that they didn't have. And it might be a person who is worried about a senior family member and the ability to come alongside their needs in a different way. So this has far-reaching implications beyond just insurance design, and that means it has far-reaching implications into budgets that will absolutely cause people to figure out how they're going to rationalize in that algebra equation, not a single point solution.
Yeah, and time will certainly tell. But it's clear that both for the employers and for the individuals, the members, that Payne has a lot of value to offer during this time of change and uncertainty as a tool for identifying some of those cost savings.
Absolutely. And more importantly, integrating those cost savings into the way that people interact. So the ability to, again, come back to that mobile application, the ability to be able to see clearly what it's going to cost, how much is covered, and where I have choices about how I interact with the healthcare system is absolutely for such a time as this. Being able to see a lower cost prescription, being able to, in the moment, in connection with my physician, understand my prescription options and where there might be a lower cost alternative. Also being able to see where my coverage options lead me to a different condition based program that might help me in a way that lowers costs for me. It is absolutely an imperative for now that we provide that for our members and for consumers.
You're right, because if I don't know in the moment how to change my behavior, then it's certainly not going to help me get to that savings opportunity. So you're absolutely right.
Absolutely.
Well, Jodi, I know we're about out of time here today. Thank you so much for giving us your perspective on what will emerge on the other side of COVID-19. And more importantly, thanks for the hard work you and the team at Payne are doing every day to make sure that plan sponsors and members have what they need to manage health during this time. And to all of our listeners, thank you for joining us today. Stay well, everyone.